So today we're talking about hip flexion and extension, the hip joint being one of two ball and socket joints in the body, and the hip, of course, is what gives us our locomotion, our mobility to be able to move, but as well the hip supports all the weight of the torso and takes on extra forces from impact from walking and running and jumping and that sort of stuff. So hips are very important. So let's talk first about hip flexion. So hip flexion is when the big femur bone flexes and comes up towards the spine. Now, we spend a lot of time in hip flexion in sitting, but as well, hip flexion happens every time we walk forward, we move the leg forward, and there's three main muscles responsible for hip flexion. The first one is called the psoas muscle, and the psoas muscle is actually attached to the lumbar vertebrae, these transverse processes starting up here at T12, but all five of the lumbar vertebrae right here on the side, that psoas muscle begins, and then it combines in with this iliacus on the inside of the ilium, this big red spot here. So that muscle all combines and comes down to cross the hip joint, and it actually attaches right here on the inside of the femur bone called the lesser trochanter. So it's a very powerful muscle. So if you can imagine this muscle here and how it is able to very powerfully flex the hips. But also, let's recognize how when we sit all day long, how it's in a shortened position. And when it gets tight and we go to walk or move or do something, that it's going to pull. And where's it going to pull at? Well, it's going to pull in through the lower back. So people with tight hip flexors, the iliopsoas muscle, we call it, combined, often will also experience lower back symptoms. Now, the second muscle is the rectus femoris, and it's one of the quadricep muscles, but it's one of the ones that crosses both the hip and knee joints. So it starts right here at the AIIS, anterior inferior iliac spine. That's a mouthful. And this long muscle will come down all the way down to the femur bone, and it crosses, it combines in with the patella, the kneecap, and attaches on the front of the tibia. So as you can imagine, that muscle as well, very powerful for flexing the hip, bringing it up. Okay, now the third main muscle, not only does it flex the hip, but it also brings the leg and turns it in and up. It's called the Taylor's muscle, but technically it's called the sartorius. And it is indeed the longest muscle in the body, not the hamstrings, but the sartorius muscle. And it starts up here on the anterior superior iliac spine. And it crosses and is like a strap that comes all the way down and then attaches here on the inside of the tibia. And so because it attaches on the inside, not only is it flexing the hip joint, but it's also turning it into some like medial adduction, it's called. So hip extension is, of course, when we extend the leg, behind the pelvis, and that's done as we're walking. Not too many other activities of daily living, but there's two main muscle groups that perform hip extension for us. One of them is the gluteus maximus. Now the gluteus maximus starts here at the top of the ilium, as well as across the sacrum and the sacrotuberous ligament. And it is a big, thick muscle that extends down and then attaches here on the back of the femur, but also blends in with the IT band which is a big, connective long tissue that goes down the outside of the femur. So that muscle definitely does hip extension. It does a little bit of sort of that lateral rotation of the hip because of the angle of the fibers, and because it is such a thick muscle, it also helps to upright the torso. So, to stand upright from being bent over. So it does that as well. The other muscle group that extends the leg behind the pelvis would be the hamstrings. So the hamstrings start here and attach on the ischial tuberosity, which is what we sit on, and the hamstring muscles, the three of them, go down the back of the leg, and they actually attach down below the knee joint. So also will flex the knee as well. But the typical muscle imbalance is that the gluteus maximus is underworked, and the hamstrings can tend to be dominant. Not only the gluteus maximus, it sits over the other gluteal muscles, do tend to be weak. So it's always a good idea to strengthen those, to pull all of this into shape with exercise.